Good afternoon, everyone.
Good afternoon.
And to the folks at home, we're going to begin with a question from Jim Hummel. Governor, with a phased reopening on the horizon, I had a businessman tell me he cannot find hand sanitizer or masks for his employees anywhere. Can the state help him and other businesses secure some to purchase?
It's an excellent question, and one that I expect to get more of. Frankly, it's why I started to make the announcement 2 weeks before I think people will go back to work, so businesses will start to make their plans. The answer is yes, but I'm not sure how much. And so we are, in fact, this morning we worked hard on this. We are trying to procure additional cleaning supplies, masks, maybe thermometers in a certain quantity that we could initially distribute to businesses to help them get off to, to help them get going. However, in the long run, that will be the responsibility of businesses. So we're working our tail off now to help with the reopening, to provide a limited number of supplies so folks can reopen and get their feet under them. But it is the responsibility of businesses to start doing that. And so I would say this is a good time to start thinking about how that will happen and making those plans. Also, yeah, I'll have a lot more to say about that within the next few days and a week.
Stephen Triedman of Eastside Monthly asks, will the State Auditor General be auditing how the corona money is spent for compliance, or will there be another entity overseeing how the federal money is spent?
Yeah, so this money will be overseen by the Federal Inspector General and Government Accounting Office and the United States Treasury. So we will be required, starting I believe in July, to give a monthly update to the Treasury Department, and then we'll have a federal audit process through that. Having said that, as I said, I am committed to the people of Rhode Island, and we're going to have a public-facing website, and I intend to have, extended dialogue with our General Assembly to solicit their views and impact, as well as stakeholders in Rhode Island. If we're going to help out hospitals, I want to hear from the hospitals. If we're going to help municipalities, I want to hear from the municipalities. But we're by law required to follow the federal guidance, and that's exactly what we're going to do.
Scott Isaacs of NBC 10 asks, do you still expect Rhode Island's peak to be sometime next week, like the model showed on May 3rd?
So it's interesting. At the moment, it looks like we are in a plateau. So while we had been, pretty much like every state, predicting the shape of a curve, which was like a hill up and down, it looks like we're in a plateau and then coming down. So I think, we're probably in our peak now. And as I say, I think of it as a stable situation, a plateau, and I'm waiting for the day when we start to see a decline.
Hannah Dickinson of WPRI Channel 12 says that 12 Response has been hearing from some viewers who say they are running out of money and can't afford food. Governor, you're hearing similar concerns. What are you doing to ensure food banks have enough supplies if they see an increase in demand?
Yeah. I have not heard that, though it's heartbreaking and not surprising. I do want to give an update on the Department of Labor and Training. Because of their incredible work, we're ahead of, as far as I can tell, every other state in how quickly we're getting our checks out, unemployment insurance checks, and the pandemic unemployment assistance. They're on average processing the checks in about 11 days. So if you haven't received your stimulus check, the $600, or your unemployment insurance check, just hang in there a little bit longer, because it is going to arrive almost certainly within days, and that should help. I'm in constant contact, the team is in constant contact with the food bank. They're in great shape, actually. Thank you to the food bank. And we are definitely helping them to raise money for that. We're also helping the United Way and the Rhode Island Foundation. So I would encourage you, if you're a family listening to this and you're struggling, call 211. It's a United Way hotline. Tell us what you need, and we'll make sure you get some help.
Ryan Belmore of What's Up Newport says that the Newport Folk Festival and Newport Jazz Festival result in an economic impact of $58 million annually for Rhode Island. How can Rhode Island and Rhode Islanders support canceled events to make sure they survive for next year?
Such a good question, Ryan, and I have been in close contact with Jay Sweet, who runs the Folk and Jazz Festival, and delivered the tough news to him that they're going to have to cancel this year. He will be in touch with his, followers around how you can help, as will, I think, every festival that cancels. And I would just encourage everybody, if you can, help them out. So I'm sure they'll be asking you to donate your ticket. If you donate the ticket back, if you've already purchased it, if you can do that, it'd be great if you could. Certainly, we're going to look to ways that we can help them, as I already explained, some of our stimulus money. I'm going to have to take a really hard look at all of the tourism industry and figure out what we can do to help. And I would ask every Rhode Islander to help in any way that you can. If you can make a donation, almost every one of these festivals has a foundation. Please, if you're a corporation, if you're a wealthy individual, if you care about the arts, make a donation if you can. If you bought a ticket and you can donate that back, do that if you can.
Our next question is from Paul Parker of the Providence Journal, and it's in regard to what the governor was just speaking about. He says that the Rhode Island Department of Health data shows that new hospital admissions peaked on April 16th and have trended lower since. What should Rhode Islanders make of this trend?
It's important for Rhode Islanders to be encouraged to see that the stay-at-home order and people following it works. And what's important is for us to continue to double down and to stick with that. If folks interpret that as saying, okay, we can loosen up now, as opposed to just thinking about how to plan for going forward, that number can certainly change. All of this is dynamic, and it's critical for everyone to understand that the work you're doing today to follow the stay-at-home order is what allows us to continue to be hopeful about hospitalizations stabilizing. But each day can change. Every day matters. So we want to really be clear about the importance of maintaining the stay-at-home order. We talk about how this virus spreads, and those numbers can change if people start coming together more. So continuing to follow the directives right now is what's going to keep us going in the same direction.
Bruce Newberry of WADK Newport asks, Governor, will you name who is on your advisory group being consulted on how to reopen economy as other governors are?
I think we have, Bruce, but the answer is yes, and we'll be sure to get that to you. I think Commerce Secretary put out an announcement, but I'll double check that.
Dan York of WPRO Radio asks, nursing home managements are concerned regarding their staff dissension with hazard pay limited to $20 or less per hour employees. There are professional personnel at equal or greater risk that may end up earning less than those with hazard pay. Why not just a straight percentage across the board for frontline employees?
Yeah. It's an excellent point, and obviously one that we wrestled with. As I said at the beginning of this, there is no perfect solution, so it was a balance. It was a balance of talking to nursing home administrators and looking at the data of which are the shifts that are most difficult to fill and where did they have the biggest shortages of workers. So a mix of that, along with, living within our means. We have a limited budget, so it was a program designed to meet our budget needs, help nursing homes do their job, and, help folks out who are working, making $10, $11, $12, $13, $14 an hour at the lowest end of the pay scale. So it isn't perfect. I hear that concern, and we did the best we could.
Ethan Shorey of the Valley Breeze says, Governor, relating to events being called off this summer, why couldn't a parade be organized where families are spaced out appropriately along the route? It seems different than a concert or festival.
So I'm going to answer that, but then I'm going to turn it over to the expert. So I just want to say these are exactly the questions that we ask. Why can't we do this? Why can't we do that? I love to go to these parades. I go to the festivals all summer, and it's not something that I want to do. Having said that, when I look at the economic pain that is being felt around Rhode Island right now, the prospect of ever again having to close down this economy is a terrible one that I'm going to do everything to avoid. Furthermore, when I think about getting kids back to school in September, I really want that to be able to happen. So although I love parades as much as anybody, I have to listen to the advice of our public health experts who are telling me, hey, Gov, it's just too great of a risk, and you could be right back where you were 6 weeks ago if you take that kind of a risk. So when I hear that and I factor it all together, it just seems like the right thing for one summer to cancel parades and festivals, even though I know that's an incredibly special part of a Rhode Island summer.
Yeah, to follow up with that, we are going with what the science is telling us right now. We know that as people come together, even with the best intentions, a large crowd, such as a parade, significantly increases the risk of the virus being transmitted from one person to another. With spreading out, it's challenging to do in a parade-type setting, particularly where children are involved and are excited. And as the governor mentioned, the risk that's at stake with that type of event outweighs the benefit of a very important and a traditional event that could occur, but it hopefully will help Rhode Island in the long run so that we can maintain many more events in the future while we take it cautiously, carefully, and safely at this early point in time now.
Michael Bilo of Motif Magazine has a similar question. What will small arts venues for theater and live music be able to do during reopening phases where space limitations causing drastically reduced capacity make operating economically infeasible? Is there a phase where capacity returns close to normal, and when might that happen?
So I'm going to ask you, Michael, and everyone to just wait a bit more, and I'll have much more specific guidance. On Monday, I plan to devote the entirety of this press conference to getting into the next level of detail around different industries and what phase one will look like. So just hang on a bit longer, and we plan to provide guidance around, number of people per square foot, different regulations for different venues. Is a bar different than a restaurant? It's an unbelievably detailed set of exercises we're going through right now. Here's what you need to know. I want everybody back to work. That's how I come at this. How can I get everybody back to work as fast as possible? And then we overlay over that what is responsible in the interest of health. Public health experts weigh in, and then, we do what they tell us. So hang on a bit longer. Next week I'll have a lot more to say, and frankly, every day from now on, I'll have a lot more to say around all of these questions that are starting to come up.
Tara Granahan from WPRO Radio says, Governor, you said you were shocked to hear that President Trump told people to, quote, ingest bleach. Since people are relying on accurate information and he never said those words, will you retract your comments?
I will retract the precise words, but I will certainly not retract what I said about the fact that I think any guidance from the president as it relates to putting any sort of disinfectant into our body as a way to make us immune from the virus is not healthy and not accurate.
Christian Winthrop of the Newport Buzz says, can you share with us an approximate timeline for when you envision each phase of your plan to reopen Rhode Island's economy to be completed? Are we looking at 3 months, 6 months, 12 months, or to get through all these 3 phases, is it longer? Do you have a best case scenario?
Yeah, so the real answer is it depends. It depends. If we reopen and things stay steady and our healthcare system isn't overwhelmed and all of our testing and contact tracing and symptom tracking is working, then we open some more. If we do that and we're staying stable and not overwhelmed, we open some more. So that's how we're going to look at it. It's not possible to say now what that's going to look like until we live it together. Secondly, once we have a reliable therapeutic medicine or a set of medicines, a cocktail, that we know reliably treats the disease, well, that's a game changer. Whether that happens and when that happens, I don't know. Finally, when there's a vaccine that's widely available, that's a game changer. Whether and when that happens, we don't know. There's a lot of speculation now. Will there be a seasonal increase? How are we going to do in the fall? How are we going to do in the winter? We don't know. So what I can tell you is, on Monday of this week, I provided a PowerPoint presentation. I'd encourage everybody to go online and look at it. It just tells you how we're thinking about it. At every step, there's, a checklist that we have to check. Are cases stable? Are hospitalizations stable? Are people not as mortality stable? Is testing working? Are we able to track symptoms? And so we're just going to monitor it for a guide. The first stage, we're looking for about 14 days of a stable trend. When we reopen in phase 1, we'll be looking for another 14 days of a stable trend. And then probably another 14 days thereafter. So that's a rough estimate. I hope we get to a phase 4, where we go beyond gatherings of 50 and fewer. But we're just going to have to, take it a week or a month at a time.
Our last question today is for Dr. Alexander Scott. This is from Ted Nisi at WPRI. Many of our viewers said they were shocked when WPRI reported last night that your department had been counting hospital fatalities as hospital discharges. Do you now see why that would have misled many average Rhode Islanders about the outcomes of these cases?
Yes, we definitely do, and we've provided language on the website to add some clarity to that. The spreadsheet that we have posted online lists people who died in hospitals as discharged. This is because our numbers are pulled from hospital data sets. And within those hospital data sets, they use discharge codes. And those codes include people who leave the hospital because they have unfortunately passed away as that code. So what we've done is updated the spreadsheet. It was already there, and we're working to make that clearer, that we have online, so that the data align with how people who may not work with health data on a regular basis or may have naturally understood that differently can now understand how we are describing the word discharge. We definitely want to be clear that it does include those who have unfortunately passed away.